Excellent. And thank you again, and thank you to the audience for this opportunity to speak about our work, the work that we've been doing with others as well, like WHO and other institutions around the world. This is an incredible opportunity to talk about also how the audience, you in the neglected tropical disease space, can also be part of this movement. We call it a movement because it is. It's a part of a group of people who have been working very closely on climate change and health for many years now, and where we see the fruits of this work now producing not only technical documents, but really actions and policies that we believe will help us in fighting and winning this fight against climate change. Next slide, please. Thank you. So for us, this, as Healthcare Without Harm, we've worked for over 25 years with the healthcare sector. And we started working really around toxics and mercury at that stage. And in the years past that work, we've been starting to really focus on climate change. And a few years ago, we published a couple of papers, of reports, along with the consulting group Arab, around the healthcare climate footprint, which was one of the first efforts in measuring the healthcare sector's contribution to our global climate crisis and how to confront it. And then a couple of years later after that, we also published the Global Roadmap for Healthcare Decarbonization, which is in line with Paris Agreement goals and tries to identify where the key areas of the health sector can contribute to reduce emissions the most, and how to tackle this in a more practical way globally, but also with some profiles for different countries as far as we could get information and data for them. The first report, the Healthcare Climate's Footprint, Elena talked a little bit about this already, but the idea here was that we found that about 4.4% of worldwide emissions were coming from the healthcare sector. Since that time that we made this calculation, the Lancet Countdown has actually been taken over and actually producing reports yearly that tell us more about the climate footprint. And we've heard, I think the last report says 4.6%. That was for this year, and it's kind of as Elena said, somewhere between 4 and 5%. It is equivalent, of course, we know the global climate footprint is equivalent to annual greenhouse gas emissions from 514 coal power plants, as Elena also mentioned. And the main thing that we do say about this is that if the health sector were a country, it would be the 5th largest emitter worldwide, and that's not that's not a low bar to cover. It's when we explain this and you say, oh, it's only about 5%. No, that's not that much. It actually is. It is a big deal. And the fact that it's coming from a sector that is supposed to heal, that is supposed to promote health, it's important that we take into consideration that. The next report that we worked on was around the global roadmap for healthcare decarbonization, and it really talked about how if we did business as usual, the health sector emissions would triple by 2050. Of course, this is unacceptable for the healthcare sector. Meeting Paris Agreement commitments could reduce healthcare emissions growth by 70%, which was also a huge finding. We also found that healthcare, it had responsibilities and respective capabilities in different countries, with rapid decarbonization of healthcare in developed countries needed in order for us to really reach the goals of decarbonization, and combined with low carbon health sector development in LMICs or low and middle income countries. This is key. In Healthcare Without Harm, what we do, we have a couple of really powerful tools that could help us bring about this change. The first one is that we host this network. We call it the Global Green and Healthy Hospitals Network. It's a bit of a mouthful, the GGHH network for short. And it has been going around for the past decade and has grown tremendously. We have over 1,800 members in 84 countries that represent over 71,000 hospitals and health centers worldwide in different regions. And as you can see from the colors, we have quite a bit of a presence in this network in Southeast Asia, Asia really, Latin America, Europe, US, with a growing network in Africa, and also a very powerful one in Australia and New Zealand. One of the initiatives that we launched with the network is the Race to Zero. We are the official UN framework for climate change health sector lead, which was born just a couple of years ago in 2021. And members of the GGHH network can join this campaign. It's the largest coalition of non-state actors and subnational governments that take rigorous and immediate action to halve global emissions by 2030, and for our sector to reach net zero by 2050. We have now, of the GGHH network members, 78 healthcare institutions representing the interests of 14,000 hospitals and health centers in 28 countries that have joined the Race to Zero through this network. Now, that has a commitment behind it, and I want to talk about that a little bit. The Race to Zero campaign has 5 very important criteria, and we call those the 5 Ps. The first one is to pledge, because we need to make sure that that commitment is made publicly, that health systems, hospitals and health centers set those targets and that are very public about it. It's a part of an accountability mechanism, if you will. The second P is about planning, and it's about publicly disclosing a plan that outlines how the Race to Zero criteria will be met, including what actions will be taken, the timeline, any institutional arrangements. And it needs to be done within the first 12 months of joining the campaign. Proceed is the third P, and that's about taking immediate action. Maybe perhaps you don't even have to do a baseline measurement of the emissions at a hospital or a health institution, but you implement interventions as soon as possible, even before having that plan and those targets. Publish is the fourth P, and that's about reporting publicly both the progress against the interim and long-term targets, as well as the actions that are being taken. And we, as the campaign states, should expect that report to be done annually. And the final P, and that's usually for those that are most mature in the campaign, is persuade. And that's about engaging with the broader community to promote climate action, including local community, but also the supply chain actors in that health system, policymakers, and gather or garner support from the public as well. And these are the 5 Ps that really comprise what we expect Race to Zero members to accomplish. With these health institutions, we have done quite a bit of learning in the past, particularly in the past 12 months, because remember, it's a pretty young campaign. But we have been gathering quite a few case studies from around the world. Now we've gathered almost 40 case studies of health systems working both on resilience and mitigation, from what approach they've taken to measuring their footprint, to perhaps already actions around how they've reached out to the community to make it more resilient, or to also how they may have improved their waste management techniques, or how they may have improved their sanitation or their energy consumption, or even how they may have changed their energy source from the regular grid to a solar powered or renewable grid. So these are very important actions that we're trying to collect so that it inspires others to do the same. We've also come up with an action plan template. One of the things that the members had been asking for many months was, well, okay, we need to do an action plan. What does that need to have? And working with them, we've developed an action plan format that has kind of the minimum requirements for them to have those first steps at putting one together. And finally, we're just really building a community of practice for the Race to Zero members, and we've been trying to gather both virtually, but also in person in different types of events, and also engaging them in different ways through surveys and understanding what might be their needs in terms both of technical resources or also what capacity building needs they might need. I actually thought Elena was going to be talking about this, but I think that she had such a great presentation. It was so rich about the new framework that I will share this with everybody, Elena. But something that the WHO is leading that is really, really important is the Alliance for Transformative Action on Climate and Health, ATTACH by its acronym. So ATTACH kind of was born out of the COP26 health program, which was an initiative that was led by WHO, the UNFCCC, the COP26 presidency in the UK, and Healthcare Without Harm working together to basically ask countries to commit to two very important actions. One was resilient health systems, and that might be by setting up a health national adaptation plan and doing vulnerability and adaptation assessments. And then there's another track that's around mitigation, and that will be around low carbon health systems. And that it may mean setting baselines and targets and putting together either an action plan or a roadmap for each country in the coming years. And some of them, actually, some countries have gone even farther than that to commit to net zero health systems. We have 76 low, middle, and high income governments that have joined the ATTACH initiative, but 28 of those have actually pledged to net zero healthcare, and 75% of those 28 are actually low and middle income countries, which is really amazing. It consists of 4 working groups on resilience, decarbonization, supply chain, and finance. And it really is a global platform and mechanism for bringing together the ministries of health, but also those of us, civil society, research institutions, technical partners, and other stakeholders who are working in the same space, who have something to also contribute technically to advance these commitments. And so it's a really great initiative, and it continues to grow. It was actually 52 countries at the beginning of the COP26 health program, and it has grown up to 76 in a couple of years. Next slide, please. And I also kind of wanted to talk about a bit of the work that we've been doing supporting health systems, not from the bottom up only, as Elena talked about, right, but also from the top down. Some examples that we have are coming out of from Europe. They're designing a net zero roadmap for healthcare. This is a report that we came up with, our Europe office came up with. It's a methodology and guidance for countries who are taking that top-down approach. We piloted a couple of years ago this project called Operation Zero, and we piloted it with 3 governments in Europe that would require to finalize the mitigation plans for the health sector, one of which was in Portugal, and you can see the plan there. And another one is in Latin America, where we've been working with the Ministry of Colombia through a bottom-up approach to work with a representative sample of facilities to measure its footprint. But they are also looking at how this will look at a plan for the sector in the coming months. We have a couple of other countries in Europe that are starting to work with us on the top-down approach, and a couple of Southeast Asia countries that are interested in also this top-down, bottom-up approach that we may be helping them with next year. Part of this work, and next slide, please, is really a bit a bit on the technical side, and it kind of goes around exactly as Elena said. I was going to explain a little bit about scopes 1, 2, 3 and the supply chain. As you notice in one of my other slides, supply chains make up the most emissions worldwide of the healthcare sector, and they are kind of the mystery box for us. It's where we have the least amount of data. We tend to do it through costing analysis rather than through other means. So it becomes quite a bit difficult to estimate them. But through Attach and through other means, we are trying to not just the measurement side, but actually do have actions that will apply to the supply chain. Part of this work then means that we need to help countries and help institutions do this measurement of their carbon footprint, both for the COP26 Health Program commitments and as a baseline measure to see how the sector is actually being held accountable and how we're moving forward in our goals. So the Climate Impact Checkup the Climate Impact Checkup tool is the tool that we came up with at Healthcare Without Harm, that we developed a couple of years. Well, actually, it's been at work for several years, but developed worldwide in the last couple of years to help health institutions actually do that. And I just wanted to share with you that yesterday we launched an online course of the Climate Impact Checkup tool, which allows anyone access to the Excel version of this tool. So if you have a healthcare institution and you're wanting to kind of understand more, please check it out. You have the QR code there and the links. The course will take you through not just the course, the tool itself, but also a bit of the background on scopes 1, 2, and 3, so that you have a bit of more general knowledge. It's meant for health professionals, policymakers, and anyone in between, really, who is interested in calculating baseline emissions for healthcare sector and continuing to do so year to year. And I just finally wanted to leave you with some thoughts about what can leadership in health institutions do. So the first and foremost, as we said, the Paris Agreement targets are very important. You've probably heard it from different speakers earlier today about the effects of not reaching the goals of the Paris Agreement targets and how it is a matter of life and death today, and how it's important to commit to reduce our greenhouse gas emissions. We also would extend the invitation for you to connect with and coordinate with efforts that are happening in your country or in your locality with other health sector stakeholders and other sectors that are already engaged. This is really important. Learn. We're still learning. We are learning. We are experts in certain things, and we're still learning about what does it mean to decarbonize. Learning from those case studies from healthcare institutions, measuring, planning, all of these are very important things, as it is setting standards and require them of suppliers, of your suppliers, to meet those. One thing that I think the NTD community is very aware of is how important the social determinants of health are, and advancing in upstream interventions that address poor health due to environmental issues, including climate change, are key here. I always say the best health intervention in terms of GHG is the one that doesn't have to happen, right? If you have clean water, if you have a clean environment, if you're living a healthy environment, the least likely you are to need the health interventions that you're needing today. Divesting from fossil fuels. We know that the climate crisis is here, and one of the major contributors is the fossil fuel industry. So understanding where those investments go and making sure that they are not going into fossil fuels, that's really important. And finally, and I hope that Robin will also talk more about this, is leveraging the voice for policies that connect climate and health. The health sector should and is and will continue to be a leader in this space. We have not only the power of science, but the power of the communities we serve, and the power of our economic power to really lead change in this area. I thank you very much again, and I hope that this was useful, and I hope to hear from you soon. Thank you.